Hi there, how are you doing today?
I'm good. How are you?
I'm doing very well. So, if you could for us, please just introduce yourself, give us your name, your title, a short bio about yourself, your credentials, and then state the title of the article you'll be talking about today.
Of course. My name is Dr. Natalie Heywood. I currently work as a clinical associate professor and the program director for the Masters of Science in Nursing programs at Arizona State University. I also work part time in the emergency room as a registered nurse. I have a doctorate of nursing practice and innovation leadership and a master's of science in nursing education. I've been a nurse for about 14 years. I spent the first part of my career in the ICU, and then I've spent the last 12 years in the emergency and trauma departments. I've been teaching in higher education for about 10 years now. I started in the undergraduate programs, specifically the RN to BSN programs, and then I now currently teach in the graduate nursing programs. The title of my article is Vaccination and Vaccine Hesitancy: Improving Nurse Confidence Can Boost Vaccination Rates.
Amazing. Well, thank you for writing that article for us. We just want to know a couple things about it. So, first, briefly give an overview of why nurses should read this article.
So, as nurses, we really have the opportunity to spend so much time with our patients and really develop trusting relationships with them. And those relationships are vital to being able to share trusted healthcare information with them, including information about vaccinations. There is so much information out there. There's actually a term that's been coined, an infodemic, which means there's so much information, including a lot of misinformation. And unfortunately, there's misinformation out there about vaccinations, about their safety, their efficacy, their importance. And so as nurses, when we talk to our patients, they trust us, they listen. And so we really have the ability to provide them with accurate information, which can help guide them to make the best informed decisions for themselves and their families. So this article is really important for nurses to read because it talks about the best ways, the best practices to talk to our patients about difficult topics such as vaccination, and how we as nurses can provide a recommendation to them that's trusted and validated with accurate information.
Amazing. And I know vaccines have been a big topic of discussion over the past couple of years, especially with the COVID-19 pandemic. But was there anything that specifically made you want to write an article on this topic? And if so, what was it?
Yeah, and so you bring up the COVID-19 pandemic, and that's absolutely it. So the topic is really related to the work I completed for my DMP project. I was about a year into my DMP program when the COVID-19 pandemic hit, and I was already really passionate about vaccinations and the preventative healthcare measure of getting vaccinations, but the pandemic definitely intensified that. And when the production of the COVID-19 vaccine came out, it really changed the trajectory of the pandemic. Yet, because of misinformation, because of confusion, many people chose not to get that vaccine. And unfortunately, it had quite an impact on the lives of many, including preventable deaths and illnesses. And so I really wanted to write this article because I wanted to remind and empower nurses to talk to their patients about vaccines. It's not about making a decision for your patients or convincing them of something. It's really about giving them a trusted, reliable voice where they can go for accurate information so that they can make the best decisions for themselves.
And obviously, this topic is very important, and there's definitely a lot that goes into it. But I know that it's a lot easier for people to understand something if they take away two to three things specifically that are the most important in a topic filled with so much substance. So, if you could give two to three things you'd like nurses to take away from this article, what would they be?
Absolutely. So, three things. The first one is your voice is powerful, you are trusted, and patients want to hear from you. Second, take every opportunity to talk with your patients and develop those trusting relationships with them, even if you only see them for a short period of time. My main area of clinical practice is in the emergency department. So for many of my patients, I don't spend a lot of time with them and I won't ever see them again. But that doesn't mean I don't take the time to talk with them, to develop a relationship with them, and take the opportunity to provide trusted healthcare information to them. And then third and last is we need to respect the autonomy of our patients to make healthcare decisions for themselves. You as the healthcare provider can provide that accurate, trusted information, but their decisions are their own and we need to respect that.
Amazing. Well, Dr. Heywood, thank you again for sitting down and talking to me about this article that you wrote for American Nurse. we really appreciate you doing this interview and writing that article for us.
Of course, thank you.